Hello, everyone. I'm Carmel Shachar. I'm the Executive Director of the Petrie-Flom Center for Health Law Policy, Biotechnology, and Bioethics at Harvard Law School. I am delighted to welcome you to our event, Can Psychedelics Save America? This is going to be a really interesting moderated discussion. My job is to be the flight attendant, telling you where the doors are, or if we had been able to hold this event in person, letting you know where you can find the coffee in the restrooms. In the case of a virtual event, I want to direct you to how you can ask questions, because this is a moderated discussion and our moderator will be pulling from questions submitted by the audience. So we strongly encourage you to submit your questions. The best way to do it is to use the Zoom Q&A feature. So if you move your cursor down to the bottom of the screen, you should see it. When you click on it, you'll be able to submit questions. The questions can be seen by the host and panelists, even if they can't be seen by the attendees. So I assure you, we are receiving them. An alternate way that you can submit questions is by joining us on the conversation on Twitter. We will be using the hashtag PsyAm, that's PSYAM. If you submit your questions there, Petrie-Flom staff will pull it and make sure it gets into the question queue. One way that you can not send us questions is by using the Zoom raise hand feature. That blue hand is really cute, but we will not be monitoring that. As well as, please do not submit questions through the chat. Really, Zoom Q&A and Twitter is your best bet. If you think this event is really interesting, we have a host of other events on health law policy and bioethics. We have an event coming up on the ethics of IVF add-on procedures, our clinics preying on patients. We are going to have an event on COVID vaccine allocation, which I think is going to be a really important topic for everybody. Coming up in February, we will have an exploration of medical stereotypes, including race. And we are continuously adding events. So if you want to keep updated on our events, the best way to do that is to sign up for our newsletter. It comes out only twice a month. We hold ourselves very strongly to that standard. And if you go to our main page of the Petrie-Flom Center's website and scroll down, there's a button to sign up for the newsletter. We hope very much that you guys will sign up for that, because it would be fantastic to have you at future events, like a conversation on women in law and healthcare with a justice from Kenya, for example. With that, I want to turn this event over to our moderator, Mason Marks, who is Assistant Professor of Law at Gonzaga University, as well as Fellow in Ethics of Technological and Biomedical Information, shared by the Edmund J. Safra Center, as well as the Petrie-Flom Center at Harvard University. Mason, take it away.
Thank you so much, Carmel. And thank you everyone for joining us today, including our outstanding panelists and those watching at home or at work. I'm not going to say too much in the way of introductions so that we can get right into the discussion, but I do want to thank Laura Chong and Chloe Reichel of the Petrie-Flom Center for their help organizing this panel and the digital symposium that accompanies it on our Bill of Health blog. So please follow the digital symposium as it unfolds over the next week. We have a great group of experts on our panel today, which I will introduce now. We're joined by Ifeitayo Harvey, founder of the People of Color Psychedelic Collective and marketing coordinator for the Drug Policy Alliance. We're also joined by Larissa Mayer, postdoctoral scholar at the University of California, San Francisco School of Pharmacy, and a member of the core research team of the Global Drug Survey. We also have Patricia Zettler, associate professor of law at the Ohio State Moritz College of Law and a faculty member of the law school's Drug Enforcement and Policy Center. And we're joined by Dustin Marlin, assistant professor of law at the University of Massachusetts School of Law and director of the Community Development Clinic at the law school. I want to acknowledge that it feels like a real privilege to be discussing psychedelics at Harvard University, a place where so much research and controversy in this area was born 60 years ago. In 1960, Timothy Leary and Richard Alpert started their research on psilocybin in the psychology department. And 50 years ago today, President Nixon signed the Controlled Substances Act into law. A lot has happened since then, which we'll now dive into during our discussion. And on that note, I'd like to start things off with the US war on drugs and the prohibition on psychedelics that dates back to the 1970s. So I think I'll turn first to Ifatayo, and then we'll hear from our other panelists. Ifatayo, in your view, how has psychedelics prohibition affected the country, and what should we learn from going on 50 years now of prohibition?
Thank you, Mason. Thank you for having me. I'll say that psychedelic prohibition has impacted us all in a variety of ways. The main reason being, I feel that it has hindered research, specifically around psychedelics, mental health benefits, and other therapeutic benefits. I think that it's hindered a lot of research. And I think it's also important to look beyond psychedelic prohibition and look at the history of prohibition in the US. Going back to the 1890s, where we first had our anti-opium laws that were primarily targeted towards Chinese immigrants. And all of our drug laws at that point were targeted towards Chinese immigrants, Mexican immigrants, Black people. And then fast forward to the 60s and 70s, where psychedelics were first made illegal. I think that given that context, you know, we're seeing a lot of hindrance around research and healing for people, but then we also have to talk about incarceration. Many people have been arrested, had their lives ruined because of psychedelic prohibition, and that's something that's not often talked about because other substances, other drugs are more criminalized than psychedelics, but it is something that needs more focus, I think, especially in these conversations, is talking about how our arrest rates and incarceration rates have skyrocketed since the 70s. And when you talk about the 50th year anniversary of the Controlled Substances Act, we really have to look at John Ehrlichman's quote, he was a member of Nixon's cabinet. And I don't know his exact wording on this. He basically says that, it was never about the drugs. Prohibition was never about the drugs. It was about disrupting the social movements that we saw in the 60s and 70s, civil rights movement, anti-war movement, and things like that. So it's affected us in so many ways.
Thank you. I think next we'll turn to Dustin. Dustin, would you like to comment on this question?
Sure. Thanks, Mason. As Ifatayo mentioned, the history of the drug war is very much one of racism and a culture war through the targeting of marginalized communities. And I like Michael Pollan's quote as to psychedelic prohibition, more specifically, that the Nixon administration really sought to blunt the counterculture by attacking its neurochemical infrastructure. That psychedelics make us question the nature of reality. And that was problematic, I think, to those in power. Preserving the status quo, preserving reality as it was prior to the counterculture of the 1960s, preserving a racist hierarchy, environmental degradation, wars, colonialism. I think psychedelic prohibition is part of attempts by the government to preserve the status quo rather than to really engage in the reckoning that citizens demanded and still do. And many of these problems are very much alive and well today as well.
Thank you, Dustin. Don't feel pressure to answer every question I pose throughout the symposium, but I think with this one, we'll go through the whole panel. So we'll turn to Patty next.
Thanks so much, Mason. And I guess I'll start just by saying thanks to the Petrie-Flom Center for having all of us and to my co-panelists. I don't really have much to add, I guess, to what's already been said. My work focuses on FDA regulation generally, and so I tend to think more about the questions about what do we do next if we decriminalize, what happens next. I agree with what the other panelists have already said. So I'll let Larissa jump in.
Thank you, Patty. Larissa?
Yeah, thank you also so much for inviting me to this panel. It's amazing to have these discussions happening, especially in an interdisciplinary frame like here. And I would add to the discussion when we at the 70s, in the United States government has funded
You're
more
breaking
than
up a little bit, Larissa. I'm sorry. I lost your audio for just a second.
Okay, I hope it's better.
Yeah,
In the 60s, 70s, the United States government has funded more than 130 studies on psychedelics, especially on LSD. And as of today, we don't have any like government-funded studies. So that's a big change. And there were in the 70s, we had more than 1,000 papers published that were very promising, and also systematic reviews that showed the efficacy and the safety of LSD in the treatment for a variety of mental health disorders. But all this research has been shut down, and the main thing of the whole scheduling, both at the federal level and within the United Nations Conventions of 1971, has really led to the thing that it's very difficult to do research on these substances, and it's very expensive. And as of today, we see a lot of private-public partnerships among universities and also startups that are coming into the space. And when we look at the tobacco or alcohol industry, we don't want any funding from them. There is a huge discussion around conflict of interest. Researchers are not eligible to accept funding, but this has changed because obviously the funding needs to come from somewhere if the government is not funding. And this is what's happening, what we see today.
Thank you, Larissa. Next, I'd like to turn to some current events. In the past 2 years, we've seen 4 cities decriminalize various psychedelics, meaning that they'll no longer prosecute people for many psychedelics-related offenses. And residents of Oregon and Washington, D.C. are voting right now on 3 ballot initiatives to decriminalize or legalize psychedelics. And so my question for any of the panelists is, what impact do you see this trend of decriminalization and legalization having on society? What do you find most promising or potentially concerning about these developments?
I'll say that there are some positive impacts and negative impacts that can come from these ballot initiatives. Obviously, there will be more awareness and education around psychedelics and less criminalization, which is great. In terms of negative impacts, I think that to some extent, these ballot initiatives can bring some awareness to law enforcement about people using psychedelics. I do know there's a case in Denver after they decriminalized psilocybin last year, where there's a guy who was quoted in a piece about it, and the FBI used that piece to track down his social media and to eventually arrest him for being a drug seller. And so I think that these things can potentially backfire because in some ways it's not true decriminalization. It's decriminalizing drug use, but we all know that law enforcement tends to trump up charges, especially if you are a Black or brown person. They can easily trump up charges from simple possession to intent to sell. And so while it is the lowest law enforcement priority, it's not true decriminalization. And I think that, I hope that it inspires people to push for all drugs to be decriminalized, not just psychedelics.
Mason, we can't hear you.
Thank you, Patty. Thank you. What Ifataya was just saying reminded me of one of the contributions to our symposium on Bill of Health. One of my students from Gonzaga, Catherine Lucido, is submitting an article about decriminalization by cities like Denver and how that can create a false sense of security in some people in those jurisdictions, whereas in reality, the drugs are still illegal and there are criminal penalties. They're illegal at the local, state, and federal level, so some people can be still be prosecuted and perhaps feel this this false sense of safety. I'll turn to Dustin next.
Yeah, thanks, Mason. I think the decriminalization efforts are quite promising, particularly in their ability to alleviate stigma. And so I'm quite excited about them. I think people should have the right to alter their own consciousness as long as it's not harming other people. And I think it's unconscionable that people are being put in prisons and have been put in prisons for 50 years for doing just that. And so I think also that the freedom to use psychedelics implicates neurodiversity as a social justice matter, that a preference for altered states of consciousness might be considered atypical, at least by today's standards, but it should be viewed as something valuable and a source of creativity rather than criminalized and stigmatized. So I would encourage people to vote if you're in DC and Oregon, particularly on November 3rd, if it comes on the ballot where you are in the future. And that's whether or not you're personally interested in using psychedelics. I think you can be an ally to others whose identities are bound up with these mystical and psychedelic experiences, whether or not you personally feel an affiliation toward them. One thing I am a bit concerned about is the variance in the scope of the measures. In Denver, we had the decriminalization of just psilocybin. Now in Ann Arbor and Oakland and Santa Cruz, DC on November 3rd, it's the decriminalization of natural psychedelics. But in Oregon, now it's the decriminalization of all drugs. And personally, I support the decriminalization of all drugs, but I wonder what the most politically expedient route would be in both Oregon and in less progressive areas of the country, whether it would have a much less chance of passing to the extent that we're going to try to decriminalize all drugs, whereas psilocybin or natural psychedelics is at some level less controversial, perhaps.
Thank you, Dustin. Larissa, would you like to chime in on this?
Absolutely. I would probably not wait for the politics to see what's going on for that question. I think Oregon is taking the right approach. We need to discuss the decriminalization of all drugs because no one should be criminalized for use or possession of small amounts of drugs, or even maybe sharing the substances. That's another thing that oftentimes comes up and needs to be addressed. When it comes to legalization, the discussion is a different one. There we definitely have to discuss what the model of regulation could be, and this will look differently for different contexts. While we will see in the next few years the medical model moving forward and regulations coming up with related to the medical and therapeutic use of these substances, we also need to acknowledge that the majority of people who are currently using psychedelics are doing so on their own or in smaller groups or in small guided experiences because they have either the privilege to access these groups or just had access to these kind of substances already. Some of them, as we've heard, are growing naturally. So for these substances, there may be different forms of regulation when compared to other synthetic compounds. But these are all things that you want to consider. And the most important thing is, as soon as the medical market will swing up and anything like legal and therapeutic will be legalized, the debate and discussion will be even broader, meaning that more people will want to have experiences with these substances, and they will find access to the, in that case, black market anyway. So if we talk about harm reduction, we also need to figure out what harm is caused by regulations or currently prohibition that is in place.
Thank you, Larissa. Patty?
Yeah, so I think Larissa's comments and others, about sort of what happens next raise some interesting questions. And as a side note, I totally agree with Ipatayo's point that there might be some misunderstanding of how safe one is in a local or state area with decriminalization. When I was teaching FDA law at Georgia State a few years ago, my students were, these are law students, often second and third year law students, shocked, right, that many CBD products are federally illegal under FDA statute and that FDA has jurisdiction over cannabis. So, it's not just unsophisticated folks who might be uncertain about sort of the legal lay of the land. But in terms of what happens next, I think there are a lot of really interesting questions. I think there are sort of two thoughts I want to throw out there. One is I think there's, obviously compelling social justice reasons for decriminalization. But if we're talking about substances, if we're talking about substances that we think might have therapeutic potential, we're sort of in uncharted waters in terms of thinking about how to have a consumer market and a market where there are incentives to do the research necessary to understand what the potential benefits of the product are. Our sort of model in terms of how we incentivize that research and how, isn't built exactly with the idea of a consumer market and a medical market. So thinking about how is it that we get both results? If we think that there are potential therapeutic benefits, how is it that we create a market where those benefits are actually proven and aren't just, sort of unsupported claims, right? How do we reap those benefits? I think the other sort of legal lay of the land thought is that the definition of a drug under FDA statute is incredibly broad. It includes products intended to affect the structure or function of the body and has been used, and that definition has been applied to drugs intended for recreational uses. So that may not affect many, or at least some, natural psychedelic products that don't have any intersection with interstate commerce, because FDA's jurisdiction is also tied to interstate commerce. But even if we're in a world where psychedelics are no longer federally controlled substances, there are other federal laws like FDA's that may apply. And so thinking through what that means and what we think the future should look like in that case, I think is also important.
Thank you, Patty. I'd like to bring in a couple questions from our audience on the medical question. We have a question from Melody Hayes, MD, co-founder of Decriminalize Oakland and Ceremony Health. And thank you for your question, Dr. Hayes. Her question is, do you believe the pathway of medicalization as a way to introduce psychedelics into the culture impairs the social justice aspirations that the medicines might bring with them?
I think that's a great question. I think I would say that if we only stick to the medical model and nothing else, then I think that it can hinder what Melody was referencing, the social justice aspects of these substances. And I say that because we have to understand that the medical industry is an extension of the carceral system in a lot of ways, right? A lot of times, medical institutions mirror bad practices that we see from police, and they also work in conjunction with law enforcement a lot of times. And there's just a history of deep mistrust and abuse from the medical industry towards certain communities, especially the Black community. So I would say that if we only go with the medical model, I think it would hinder a lot of the social justice around psychedelics. I think that we have to be holistic in our approach and not only pursue the medical model.
Thank you. Would any of our other panelists like to address that issue?
Yeah, I'm full-heartedly agreeing with Ifetayo. I think it's very important to actually look at the different contexts and meanings for different people and what's happening also like culturally. And for many people, like the medical model will not work and the community-based model may be more appropriate, where they can like decide like when we look at indigenous populations who are having thousands of years of experience with traditional and ritual use, it's always like validated or accounted for by the community. And there is also a specific realm of like self-regulation that comes with that. Whereas in the medical model, you have everything like top-down organized for people, but that's not what everyone is gonna seek. And also we have to be clear that technically the psychedelics are so promising because they were giving us a hope to move away from the medicalization of the society back to a space where we can connect to nature and ourselves better, thanks to maybe one single transformative experiences, which would mean that we would need to use less or no psychiatric drugs anymore, right? So that's a totally profound new concept, that there can be something that is like away from medicine and something where a community actually steps in to help that healing process. And if we just have the medical model that keeps on looking at outcomes just based on the mental health status and symptom treatment, it's just another band-aid that we add, and we're never getting down to the actual roots of the problems that obviously in this country include the systemic oppression of communities of color.
Thank you, Larissa. Patty, I want to turn to you, but first I want to add a little something extra from some questions that involve the FDA, since you're an expert on FDA law. And then if other panelists want to add anything, please feel free to. We have a question from Jake Evans, and Jake asks, in my view, the ballot initiatives are representative of impatience with the FDA processes and skepticism about what access might look like post-rescheduling and FDA approval. Do the panelists have an opinion about channeling local energy into alternate legal pathways that circumvent or maybe complement the FDA approval process? And then we had another question from Dick Simon related. What do the panelists think about the impact of state-by-state decriminalization efforts on the FDA approval process?
Yeah, so I would, I don't know, I guess, the sort of legislative history of the current decriminalization efforts to know whether they reflect impatience with FDA or social justice concerns about the war on drugs and, the sort of history of racist policing around drug enforcement. But, I think a couple of things. One, whether we have an FDA or not, whether there's an FDA process or not, taking the time to do the research to really understand the risks and benefits of products that will be used as therapies and maybe non-therapeutic uses as well takes time and has to be done. If we want to have beneficial innovation, if we want sort of the benefits from particular interventions, science takes time, whether there's an FDA or not. So, we think about FDA as sort of, often we think about FDA as having this role of physically protecting us from unsafe and ineffective products. But FDA gatekeeping also has this role of sort of a legal mechanism of forcing that research to be done to make sure the innovation we get is actually beneficial, to make sure we're not all spending our money on CBD that's marketed for COVID, right? Without that FDA gatekeeping, we often get a lot of products that with a lot of claims that are not well supported. And I don't think we want to end up in that world, or at least I would argue, like as a public health matter, we may not want to end up in that world if we really think there is therapeutic promise. And, we could talk about what those endpoints should look like and things like that. I would think that patients being sort of not needing other psychiatric medications in the long term would be a very compelling endpoint. In terms of state and local efforts, state right to try laws didn't change any federal requirements. They obviously did sort of have an important political impact in creating sort of political will, perhaps, for the federal right to try law that did change federal requirements or sort of create a new federal pathway for pre-approval access to investigational or experimental interventions. So, I do think state and local efforts don't change the FDA approval process per se, right? FDA is not going to approve psilocybin based on different evidence because there's been decriminalization efforts than it would normally expect. But state and local efforts can sort of be a tool to sort of express our will, right, about what we think the world should look like. And that might motivate Congress to make changes or might motivate agencies to take a different approach at the federal level.
Thank you, Patty. And I'm glad you brought up safety. I want to return to that in a little bit. But first, let's turn to Dustin.
Patty, I think you made a lot of really helpful points. And I also liked your tweet where you talked about in terms of the FDA, that breakthrough status doesn't necessarily mean a breakthrough. And I think that's a helpful analytical distinction. But I guess my issue is sort of, I hope that we won't take a myopic view that the FDA needs to approve these in its entirety before we would end prohibition or at least relax restrictions at the state and local levels, given the efficacy that's been shown in psychedelic research so far, and the mental health epidemic that's going on, made worse certainly by COVID-19, as I know Mason's written about. And I'm also driven by Larissa's point that people in indigenous cultures have been using and having breakthroughs in consciousness, using these substances for thousands of years. So I'm wondering, it's so difficult, given the ineffability of the psychedelic experience, to provide the sort of empirical evidence that the FDA normally requires. So I'm wondering if, given the history of the war on drugs and the nature of the psychedelic experience, whether the FDA would or should take into account both indigenous knowledge as well as the subjective and anecdotal experiences of people having these psychedelic experiences. So I guess I'm wondering, as a descriptive matter, if that's doable in terms of your expertise in the FDA realm, and also if you would agree with it from a normative perspective or not.
Yeah, so I guess quickly, I don't want to take up too much airtime. From a normative perspective, I didn't intend to suggest that prohibition efforts or decriminalization efforts at the state and local levels should wait for FDA approval. I guess what I mean to suggest is, I think we have to grapple with the fact that if we have a widespread consumer market, we may have trouble as a society conducting the research, getting people to participate in research rather than just buy something at their local store, to actually understand the therapeutic benefits, that the sort of full range of therapeutic benefits we might see from any given psychedelic. So there's we might still think it's a great idea to move forward, and maybe there are, sort of reasons around the history and sort of the social justice problems associated with the war on drugs that make us think we don't want FDA in this space. But we don't currently have a different model, I think, in my view, to make sure we actually get that research. I think FDA actually can be really quite flexible, sort of descriptively, in terms of what kinds of data it views are sufficient for approval. And many would argue it is too flexible, right? That the standard for approval is too low. But FDA has approved, non-therapeutic uses of products like, Botox for facial wrinkles, right? And often the studies for those are based on patient reports of their own sort of perceptions of whether their faces look better, right? Or whatever it is. So I think there is a tremendous amount of flexibility under the law. I would push back on the notion that we can accept necessarily anecdotal evidence or accept early evidence as enough. There's a long history of, you know, medical products having a lot of promise early, or potential medical products having a lot of promise early and then not ultimately being proven. And as long as we have sort of the market we have and the sort of capitalist culture we have around medical products, we're going to see companies come into this space and push, you know, whatever psychedelics might look promising for those uses. And, you know, maybe that's too cynical, but that's just, you know, what I think is going to happen.
Any other thoughts before we move on? I do want to return to this issue of safety, though, and ask the panelists, how much safety is enough with respect to psychedelics? You know, do they need to be FDA-approved, complete phase 3 clinical trials in order for us to be comfortable that they're safe, or is there enough evidence out there now to suggest, and this kind of, you know, that their safety, and this kind of ties into the discussion we're already having? I might ask Larissa, because I know that you've done a lot of work in surveying populations on drug use and side effects and things like that. Do you have any thoughts on safety?
Absolutely. I mean, the big up of the medical model, when we want to get back to that, is really that you have that medical screening prior to entering treatment. And so that assessment is very crucial and important. And that's happening already in all of the studies that are conducted. What we can say from asking a lot of people who use drugs about their use. So just to give you like a number, we have each year about 40,000 people who have used. They're taking our survey online, and they have already used psilocybin or LSD. It's an overlapping population because most of them have experiences with both, and only half of them would have used it last year. And these people are asked about emergency medical treatment seeking following the use of the substance. And we ask also for all the common substances, how often this occurred. And we really see year after year, and we're running this since like 2014, that magic mushrooms or psilocybin have like the lowest risk potential or adverse effects. Like it has been like from 0.2% up to 0.4% of people, like these 20,000 people who have responded, right, who have actually had an emergency following the use. So psilocybin is considered very safe. It is, of course, like a dose-related relationship. Like with every substance, we have to be very clear on that. And there are people who like to use heroic doses. And for these doses, there are other requirements or other like recommendations to make. But the more we have a dialogue about it, the better we can also talk about safer use and give recommendations. One of the most important recommendations is really also not to combine these substances with other drugs. And clearly, what we see with MDMA, that leads to a little bit more, but also not more emergency medical treatment seeking, is that all of it, or basically more than 90% of it, occurs with the also occurrence of alcohol. So it's not just one drug that leads to the emergency. There is more than that included. And the last point I want to make is the duration of use. When we look at LSD, of course, it is the duration of the effect, of the psychedelic effect, is much longer. With psilocybin or a normal dose of magic mushrooms, we look at 4 to 6 hours, and with LSD it can be easily 12 hours. And if you don't prepare for that, or if you're outside and it gets dark and it gets cold and you're losing your orientation, these can all be things that are overwhelming for you, or if you're with the wrong people or in the wrong setting. So set and setting matter a lot. And that is not new. That has been brought up by Leary and Sinberg all over again. But these are things that people need to be educated about. And when we come up with discussions around whether psychedelics should be like available for adult use, for the non-medical adult use, we also have to talk about cultural context and education in addition to that. Cannot just give it out, but technically from the efficacy profile, it's relatively safe if it's the substance that you expect it to be.
Thank you, Larissa. Any other thoughts on safety? Dustin?
Yeah, I agree with all of what Larissa said. I think I would just add that we're sort of in a catch-22 given that these are Schedule I substances. It's been so hard to research them for so long that we don't have the data on safety. We don't have the data on efficacy that it would be nice to have. I guess, I mean, one way that we might get that is to use states as sort of laboratories of experimentation. Oregon in particular, Measure 109, if it passes next month, it would allow inpatient or rather in-facility assisted psilocybin therapy. And through the data that can be gained from that program, perhaps we could see how that works, and that would give us enough data to then potentially expand that program more widely. But Oregon in that way might be able to serve as a catalyst for the rest of the country.
Thank you.
I just wanted to add on really quickly that I agree with everything that Larissa and Dustin just said. I think that to some degree, safety is a loaded word, and because of prohibition, a lot of us have, taken in a lot of drug war propaganda around safety of substances, and ultimately, a lot of the policies around drugs that we've had in this country are more dangerous than the substances themselves. So I just wanted to say that. But then also, there's also a underlying sentiment in a lot of psychedelic spaces that I'm in that psychedelics are for everyone. And I think that's not true. While that would be great, but psychedelics are not for everyone. There's a lot of people out there who, might be on certain medications, might have certain physical ailments that prevent them from being able to safely use psychedelics. And I think that's something that's really important to understand, that psychedelics are a tool, and there's other tools that are like psychedelics that we can use that don't involve taking these substances. And so I think that what Larissa was saying about the educating people on set and setting, and other harm reduction practices is going to be really important for the future, because like Dustin said, we don't have a lot of research, and there's limitations to the research that's happening.
Thank you.
Yeah.
Oh yeah, please. Please, Patty.
I really like Ifatayo's phrasing of safety as a loaded word, which I totally agree with Ifatayo's point. I just want to, I guess, suggest one other way that safety is a loaded word, even in sort of the traditional FDA public health context, right? Safety is kind of meaningless in the absence of considering the use of the drug and how effective it is for that use, right? A drug for stage 4 pancreatic cancer that cures 50% of people and immediately kills 50% of people is probably safe and effective because pancreatic cancer is so deadly, right? So safety doesn't really mean anything in the absence of knowing how the drug will be used and with whom the drug will be used and things like that.
Oh, that's a great point. Thank you, Patty. And that makes me want to kind of raise what might be at stake here. I mean, we, for the past 20 years, we've seen rising rates of depression, rising rates of substance use disorders, rising rates of suicide, and the COVID-19 pandemic is making that worse. And meanwhile, a lot of the tools that we currently have available to the field of psychiatry, like selective serotonin reuptake inhibitors, are not very effective for a large percentage of people. Sometimes up to 60% or more of people don't get little or no benefit from taking one of those drugs, and they continue to be treatment resistant after trying several drugs. So I guess in that context, how does that change the safety sort of calculus, taking into account the fact that even before COVID-19, we were experiencing a mental health crisis in many different ways in this country, and now that's been exacerbated? How should that affect how we view the safety of psychedelics?
Should I go first with the safety questions again?
Sure, by all means.
All right. I guess what we have to be clear is really that technically from psychedelics, people cannot like overdose and die. And also when you look at the United Nations and the current like discussions around the regulation of new psychoactive substances and other things that are very harmful, we have to see that none of that has happened with psychedelics. They are like non-addictive. And when used in the right setting and especially in the right mindset, there is absolutely like no risk of fatal death or accident. Again, there can be like if someone is really concerned and suicidal and alone, that is absolutely not the moment to use a psychedelic substance, especially if they haven't done it before. So that goes back to the education part. But we have to say that in the United States, more people are dying from suicide than even from like military shootings or like people who are currently in the war. So this is one thing. And when we talk about whether psychedelics can help save America, we also have to look what's currently going on in this country and what is like contributing to mental health issues. And we've seen 2 days ago again in Philadelphia, the police shooting of Walter Wallace. He died. Another young black man, a family father, who died because of a situation that could have been de-escalated differently, very possibly, and this has not happened. And this person was in a mental health crisis. And the response that we currently have in this country when it comes to mental health crisis is just oftentimes not an appropriate one. And then we don't have to talk about psychedelics or not. And for that person, or also for people who are unhoused or in very vulnerable contexts, we cannot believe that just like this one magic trip will change something for them when we put them back in the same environment with all the risks and vulnerabilities and all the struggles that they face day to day. So there needs to be like a profound systemic change going or proceeding, that kind of desirable thinking that psychedelics can then eventually be used to help deal with that trauma, and only if this kind of interventions will be community-based again, if they're happening in the community and not necessarily as prescribed by the doctor.
Thank you. I want to turn to an audience question. This is from an anonymous attendee. Given how many people who identify as spiritual or not religious, but not religious, use psychedelics for their spiritual development, is there a case to be made that our concept of religious freedom should be updated to include perhaps the exploration of consciousness? Currently, there are some groups that have gained exceptions to be able to access certain psychedelics for spiritual purposes. But Dustin, please. Dustin?
Sorry, I was struggling to unmute myself there. I think that the religious freedom argument is an interesting argument, and it would be great if, I mean, you, especially in considering a Supreme Court that increasingly values religious freedom, would be receptive to that idea that the psychedelic experience has numinous, either religious as interpreted broadly, sort of beyond Western religion, or spiritual significance. I think based on past precedent, it would be a difficult road to get there with a religious freedom argument. How do you define religious? Also, how do you define freedom? Might be seen as skeptical to the court unless you've been following a religious practice. The word that comes to mind, it's not a great one, is religiously for so many years. I think that if you're it would take a plaintiff who really did consider the psychedelic experience to be a sacrament rather than the casual person who uses psychedelics to get there. And as Mason mentioned, these are arguments that have been made, and certain groups have gotten carve outs such as the Native American Church to use peyote and mescaline. I think ayahuasca too, but these are narrow religious exceptions that I think might be difficult to turn into widespread ones.
I want to just mention a couple comments from our audience. Michael Braden made a comment. Michael's a PhD in medicinal chemistry of psychedelics. Michael says there are plenty of animal studies and a ton of anecdotal information that serotonergic psychedelics such as LSD, psilocybin, et cetera, are very safe from a toxicological standpoint. And I think we brought some of that out, that toxicology is very important, but there are some other issues like the set and setting that some of you mentioned. And Dr. Melody Hayes had a comment about safety. She says, as a physician, may I add a comment about the question of safety? The currently legal mind-altering substance is alcohol, which is associated with increased risk of violent behavior such as rape. Medically, alcohol increases the risk of depression, cardiovascular disease, liver disease, and neurological decline. Yet it is a legal substance. So just pointing out some of the kind of idiosyncrasies of the way that we regulate some substances differently than others here in the US. I want to turn to a question about indigenous cultures and how many cultures have used psychedelics for hundreds, if not thousands of years. How can the United States move forward and benefit from these substances while also respecting those long-standing traditions? Or can it? Is that possible given our current systems?
I think that we have to confront the harms that have been done towards a lot of indigenous groups throughout the Americas, right? Both North, South, and Central America, and do what we can to right those wrongs. And when it comes to integrating these substances into our decriminalization efforts or legalization efforts, I think that we should really look to the guidance of these groups in question before even taking a step forward, right? There's a lot of controversy recently around the decriminalization nature efforts in different cities and their relationships to peyote. And there are a lot of indigenous leaders asking them not to include peyote in those ballot initiatives because peyote is endangered, it's not easy to get. And so that's a prime example of what not to do. We need to be working under their guidance and not the other way around, because that power dynamic basically is symbolic of colonialism in the history.
I was just going to say, Mason, anything's possible, right? Right? Especially if we're going to think big about sort of changing, society.
Do you have the answer, Patty?
No, but I sort of echo Ipatayo's point about making sure that we're hearing and following the voices, the communities that we ought to be, and being mindful of unintended consequences, I think is important.
Thank you. Dustin?
I do think I agree with the comments so far. As a trademark lawyer by day, I think that there's a trend that's problematic, and we see it in the cannabis industry as well. You have a franchise that's popped up called American Shaman, and they are selling CBD products, the non-active, the non-psychoactive ingredient in cannabis, and referring to sort of heavily capitalized and watered down form of shamanism. There's a company who's harvesting magic mushrooms called numinous, and that one isn't, I guess, quite so bad in its generality. There's also an analogy I'm hearing to Oregon's Measure 109, the psilocybin assisted therapy, where they were saying that the guides are akin to shamans, which I think is problematic, and it's, you know, I think the analogy is a little bit ridiculous, and it breaks down. So I don't think that using the plant medicines themselves is cultural appropriation as they exist beyond culture, but there is a certain tactlessness to commodifying and capitalizing them. Although I would say that I can't imagine any cultural appropriation worse than prohibition. You take sacred knowledge and you ban it, and you convert the psychedelic identity from a valuable and respected spiritual and creative practice to one that's ridiculed and treated as drugged and delusional and dim-witted. And I think that's the worst kind of appropriation, is the prohibition that we've created.
Thank you, Dustin. We are running short on time, so what I think I'd like to do is I just want to go around to each of the panelists. This is something I saw our Petrie-Flom faculty director, Glenn Cohen, do on another meeting. And just, if you could give me like your sort of tweet length version of what you'd like to leave the audience with, that would be great. So just in sort of a tweet length statement, what would you like to leave us with? Ifatayo, you look like you have something you'd like to say.
What would I say? I'll say that we need to end the war on drugs, and we can start by doing that by decriminalizing all drugs.
Thank you. Larissa?
Yeah, I would just take it from there and say we need to decriminalize all drugs, and we need to invest in evidence-based science, but not forget the voices of the community and the importance of being in community as the opposite and account, or the opposite to actually being in isolation, what COVID actually does. And that's what we need to fight against. We don't need to fight the drugs, we need to fight the isolation.
Thank you. Patty?
I think Larissa hit on some of what I was going to say. Just you know, I'm curious to think about what comes after decriminalization and how we harness the potential therapeutic benefits without overhyping them, and you know, move forward from a public health perspective.
Thank you. Dustin?
We should have the freedom to alter our own consciousness. We should also respect the freedom of others to do that if they wish to do so. Please vote yes in Oregon. Please vote yes in DC. Please vote yes around the country for psychedelic decriminalization efforts.
Thank you so much. I really want to thank our wonderful expert panelists for joining me today. And I also want to echo Dustin's request that everybody go out and vote. It will be very interesting to see what happens with these ballot initiatives next week. And also, please do go online to our blog, Bill of Health, to follow the digital symposium that accompanies this panel. We'll be adding new blog posts every day for about the next week or so. So check that out to continue the discussion. And I'm sure this is only the start of this conversation between all of us. So I'm sure there'll be many more discussions in the future. So thank you so much. And I hope you have a great rest of the week.
Thank you.
Thank you.